For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. It, as usual, great to be with you on this Tuesday. Today, we want to highlight a number of things. We want to talk to you a bit about what's happening with the numbers as we usually do, highlight the work we've been doing with our skilled nursing facilities, and then go into the new equity measure that's been announced this week with Dr. Pon, reminding you a little bit about how important it is to wear your face covering and the impact, and then end with the county tier assignments. So here we go. So today, a low case count, 1,677 cases reported to the state, hopefully within the multitude of factors that goes into everyday's numbers, that we're seeing true continuation of a downward trajectory in most of the states. But I'll remind you that parts of our state, we know we're seeing increased number of cases that our effective value that we talk about, that the governor highlighted a week ago, that we still see that going up in certain parts of the state, and that raises some concern. As you see, this 7-day average of just over 3,000 cases still reminds us that we're not out of the woods, that yesterday we reported over 4,000 cases, and that number of cases on a daily basis will certainly challenge our county's ability and our statewide ability to do the right disease investigation and contact tracing. So although there is some encouragement here, we know that we still have work to do. Our testing volume is back after many weeks of being a little lower due to fires and closures of some of our sites because of air quality and heat. We see that number coming up. Today's 14-day test positivity is 2.7, and the 7-day is even lower at 2.6 statewide. So these are numbers that in many ways are encouraging and go along with reduced hospitalization numbers across the state as well. So all of these are important signs to continue to monitor, but remember that there's an important lag between what we see in our cases and then when we see hospitalizations, 20 to 30-day difference there. So we continue to learn that and apply that to all of our moves and supports of our counties as we go forward. Early on in the pandemic, we focused on vulnerable populations, and we continue to. We talked early, even before the statewide stay-at-home order, we protected older Californians, asking many to stay home, really focused on our skilled nursing facilities, our residential care facilities for the elderly. And despite those early efforts, we still saw, just like so many parts of the globe and parts of the nation, saw a high number of cases in congregate facilities for older Californians, skilled nursing facilities. People call them nursing homes, lots of different names. But as you see from this slide, back in April, we saw a high of 463 new SNF cases in one day, 91 deaths in skilled nursing facilities. It's no wonder that a majority proportion of the deaths in any one age category come in that age category of 80 and over. 70 to 80-year-olds also experience high levels of death. So really a disease that we know impacts, for its worst outcome, older Californians in a way it doesn't impact younger Californians here or anywhere in the globe. You see on October 2nd, just last week, we registered the lowest number of new skilled nursing residents who are positive at 52 and had the smallest number of reported skilled nursing facility deaths related to COVID on any day. So lots of progress between April and October, and I want to walk you through some of the specifics. This graph shows the gray shaded area is what happened with cases across the state. All cases, regardless of age or location. You see the yellow line signifies what has been a moving target for skilled nursing facility cases of COVID-19 early on the left-hand part of the graph, showing the early phases or stages of COVID-19 response, where we saw a radical rise in cases to then come down. And now on the right side, showing that in fact the cases in skilled nursing facilities are lower even in proportion than the statewide cases for all Californians. The lowest line, that darker orange line, is really signifies our deaths. And as you can see on the left-hand part, in the early part of our response, early April into May, we saw a large proportion of the deaths in California from COVID-19 in skilled nursing facilities. And those have over time come down and really come down to their lowest point today. So this has been an area of focus. We've shared data on skilled nursing facilities throughout our conversation and dialogue on COVID-19. We are grateful for all of our advocates and the families and the partners we have throughout communities, some of those operators as well, who every day come to work trying to improve the conditions for residents and face COVID-19 squarely and try to improve our outcomes. And this is, I think, a moment where we continue to celebrate some of the achievements, but maintain our resolve to do even more. Some of the key strategies that we've deployed are targeted testing and cohorting, meaning that as we identify individuals, either residents or staff, that we move and make sure that we reduce mixing. All of the things that we talk to you about every single day, we deploy and employ in skilled nursing facilities as strategies to reduce transmission. We implemented mitigation plans across all of the facilities through our county partners and as the state. These included on-site visits by surveyors at least every 6 weeks, planning around personal protective equipment. You'll remember the shortage of masks and gowns and all of the tools that we know go into protecting individuals as they're interacting with others, including improving our staffing and allowing us to put together support teams of staff that can go into facilities and help in times of need. Communication with residents and families. Some of the most difficult moments in the whole response have been depriving individuals in facilities, in congregate facilities, and their family members from visitation and sharing moments together, returning that after months of really being cautious, just like the whole nation was, to make sure that we protect our residents and family members. This comes with a lot of staff training and a real focus on infection control. Other strategies are expanding the statewide infection prevention and education resources. This includes dozens of webinars and educational videos that are available to skilled nursing facilities, phone calls and technical assistance supports, and ongoing education around all things when it comes to reducing infections and spread in facilities. And then in an exciting way, really deploying. I often say that COVID has helped us move forward innovations and progress even faster than we would have normally done. And this has really supported the state Department of Public Health to work on new tools to allow us to predict things that are coming with our analytics and data management tools. We've talked about the importance of facility testing. I wanted to share with you back in June, we talked about completing baseline testing. We have done that. Almost 230,000 tests done in skilled nursing facilities. We found that roughly 7% of our residents tested positive and just under 3% of the healthcare workers, which we knew were a focus. We knew we needed to protect those workers, make sure that when they came to work, we knew their status, that we could give them the protective equipment so we didn't have widespread transmission in a facility. And here we show that just under 3% when all were tested were positive. We continue to do surveillance testing on a weekly basis that about a quarter of every facility staff are tested. And for every facility that turns up a positive test, that we're committed to having broad scale testing in that facility to make sure we continue to detect cases that might be asymptomatic or unknown until we're confident that there's no cases in that facility. We publish this on a SNF testing dashboard that's available through the CDPH website, and we continue to implement the new federal requirements to do weekly screening across many of these facilities. Again, just coming back to what is an exciting tool, this predictive analytics and data management. On a daily basis now, we're getting survey results from our skilled nursing facilities on staffing levels, on the availability of protective equipment, and on any needs that they have. We have an urgent needs website or dashboard that allows us to get that early alert system in place that allows a facility to say, hey, we have a need. We hope that the state can support it. And in many instances, we're able to. This allows those facilities to keep up with the staffing to make sure that we don't have any opportunities to have broad scale spread in a facility that is maybe COVID free at the moment or working to get an outbreak under control. And we use this data to really prioritize the use of our resources and, of course, to work closely with high-risk facilities so we don't endure the number of cases and certainly the number of deaths that we saw early on in the pandemic response. I now want to turn this over to Dr. Erica Pond to come share the exciting news about the new equity metric that we have implemented today. And then I'll be back with you to share our tier assignments.
Thank you very much. Good afternoon, everybody. As Secretary Ghaly mentioned, we had first announced when we first unveiled our blueprint framework that we would have a health equity metric, and we are very excited today to share the details of that metric. So we all know that low-income Latino, Black, and Pacific Islander Californians have been the hardest hit in this pandemic. Our goal is to reduce disease transmission in all communities, especially those most at risk. So we have announced this today as the implementation, and we are really excited and thrilled to share that we are the first state, to our knowledge, that has not only elevated the importance of addressing these disparities head on, but we are elevating it to be an all-state, all of California approach. So this is not just government, this is not just public health, this is all of us coming together. We want all of our businesses and our communities to come together and realize that it is so important both to address these disparities and actually to interrupt disease transmission and really address this pandemic head on. We have to prioritize our interventions to the communities where we're seeing the most disease. So what our new metric does is it looks at the communities where we're seeing the most disease transmission, which, as we've again noticed, are most impacted are essential workers, people who don't have a choice, who have to go outside of their homes and couldn't stay at home and are working diligently to help take care of us. So we are prioritizing those communities and looking and seeing that if a county is going to move forward, their test positivity has to be, the test positivity of the most disadvantaged actually has to match the next most restrictive tier, least restrictive tier, excuse me. So we're incentivizing counties to reduce those infections across every neighborhood. So the counties with the lowest disparities or the least differences are going to be able to move more quickly through the color tiers. And the counties that are not addressing yet those disparities or are not quite reaching the lower test positivities in the areas that have the most disadvantaged or with least opportunities are going to move slower through the color tiers. So again, we're really excited that this is the first in the nation that we know of. And again, it's a really all California approach. We also wanted to highlight again, we just cannot emphasize enough, as we slowly and safely and stringently open our economy, we need to all continue to wear our masks. So this is a really great illustration of how to wear your mask appropriately. You need to cover your nose and your mouth. And you can see here that what happens is if you walk around and you have your mask below your nose, you can still be exhaling droplets or aerosol to each other and to the community. And the mask really helps in both directions. It helps protect you from droplets and aerosols, and it can help protect the wearer. It helps protect others from decreasing the transmission. So again, as you see a lot of people who let their mask slip below their nose, they are again exhaling and disseminating droplets out to others. So we really, really want to emphasize making sure that you are always wearing your mask correctly. And then we also just wanted to highlight, again, when people are not wearing masks and there's a lot of transmission of droplets back and forth, how quickly, again, this virus can transmit. So you've also heard us talk a little bit about something called R-effective and how many people one person can infect. This is an illustration of if each person infects 2 other people, how quickly, again, it can really escalate and become exponential. So that is why we all need to be wearing our masks to prevent disease transmission and help us remain in a stable place. We have been highlighting that our cases have decreased from our peak over the summer, but they have been plateauing. And in order to keep safely reopening, we need to all be doing these other interventions. So with that, I will turn it back over to Secretary Ghaly to discuss the tiers.
Thank you, Dr. Pon. So just by way of reminder, the blueprint for a safer economy is our strategy, now just over a month old, for criteria to loosen and tighten restrictions on activities in our communities. It's focused on test positivity, adjusted case rates, and today, no longer the forthcoming, but the actually implemented health equity metric, as Dr. Pon enthusiastically discussed with you moments ago. Again, 4 tiers: widespread, substantial, moderate, and minimal, purple, red, orange, and yellow, each county moving through those tiers based on where they started on August 31st, their initial assignment, required to stay in a tier for at least 3 weeks, and 2 weeks consecutively of meeting the threshold for the next least restrictive tier to be able to move in that tier. So this slow, stringent approach, we believe, is carrying California well. And based on these thresholds and categories, we're seeing movement. I'll remind you that when we began, 38 counties were in the purple, and today that is down to less than 20. And so we've seen a number of those counties that started in widespread move to at least substantial, and some of those even already getting close to moving to moderate. So today, 3 new counties are moving from purple to red. That's Merced, Ventura, and Yuba. 1 county, Inyo, is moving from red to orange. And we have 4 counties moving into the yellow, our least restrictive tier: Humboldt, Plumas, Siskiyou, and Trinity. And I'll highlight here that Humboldt is a county that's actually moving forward because of the equity measure and the performance on reducing or ensuring that transmission in some of its more impacted communities is at least as good as the county as a whole, and lower than not just the tier less restrictive than where they were, but actually 2 tiers less restrictive. And then 1 county is moving back to purple, that's Tehama, and another moving to red, and that's Shasta County. We, of course, have been in close dialogue with these 2 counties. We recognize these are the first 2 counties that, through our tier system and our blueprint, are moving backwards. We recognize that these are important moves at a county. We have spent quite a bit of time looking at the data, ensuring that the trends are correct over the last 2 weeks, and thoughtfully proposing these implementations here and the requirement to move back a tier to a more restrictive tier for these 2 counties. So as we always end before we go into questions, and really emphasizing, as we see increased movement in our tiering, the importance of these simple tools that we can all employ. Wearing a mask, as Dr. Pon described, really not just covering your mouth, but making sure that your nose is covered. Using it I always challenge people to use it a little longer than you thought or think you should, just to make sure that we don't increase and put our guard down just for that moment where transmission can occur. Maintaining 6 feet of distance, washing our hands, avoiding mixing when we can, and of course, as we go into flu season and winter, to get your flu shot and do it as soon as you can. So with that, I thank you for tuning in, and I'll turn it over to the first question.
Samantha Young, Kaiser Health News.
Hi, Dr. Ghaly. Thank you for taking the call, for doing this call. I had a question, a follow-up related to something I asked you a couple of weeks ago. And I wanted to ask that if the state has any plans to modify any of its guidelines now that the CDC has updated its guidance to reflect that, COVID can spread much more easily indoors.
Yeah, I think it's a very important point, and we recognize we currently don't have plans to update it at the moment. We've all along really emphasized that outdoor is lower risk than indoor, and that's why indoor activities are done at lower levels of operations with even finer or more attentive details to how we modify business sectors. So we encourage people to try to do as much as they can, businesses included, outdoors. But for the time being, we still continue to emphasize that remaining physically distanced, doing things outdoors when possible, wearing your face covering throughout your interactions as much as you can as the key strategies to reducing transmission. Certainly, the state has always reflected a willingness and openness to follow the data, follow the science, and make modifications as necessary. We've learned so much throughout the entire response. When I look back to March and April and some of the messaging, and I think about it today, we certainly have transformed it and paid attention, and we're open to continuing to do that if and as necessary.
Brady McDonald, Orange County Register.
Hey, Dr. Ghaly, I had two theme park related questions. First, last week you said theme park reopening guidelines are nearly ready. How long do you anticipate it'll take to iron out the guidelines with the industry stakeholders? And second, what are the major sticking points on the theme park reopening guidelines? Thanks.
Yeah, thank you for the question. And theme parks continues to be a high priority for the administration, and recognizing their role as both part of California life, but also employment opportunities for thousands of Californians. As we do with every sector, we don't take that lightly. We're working closely with a number of the direct operators of theme parks and also the overall agency or organization representing theme parks, as well as the labor partners that represent the workers, and ensuring that we move forward together in a low risk and safest way possible. I'm not sure when those conversations wrap up. I will tell you that they will wrap up as soon as we come to really hear the industry and understand some of the concerns, and we continue to look at the data and information that we have. So no promise of a specific date, but I will say as soon as possible. Some of the important issues that we're looking at are obviously not just how the operations in the theme park go. I think there's so many important, thoughtful people who are working in many of our sectors across California who have been thinking about this with a great deal of passion and energy, not just so that they can reopen, but also so that they can make sure that staff and patrons alike are in the safest position that they can be. But broader than that, really looking at the impact that the sector of theme parks really has on broader communities, on the surrounding neighborhoods and the workplaces and the industry around, and how this isn't just about one piece, it's about the entire community, and having dialogue with not just those operators, but others who both have a stake in what happens with this guidance, but also have a responsibility to reduce the risk for so many people from California who might visit a theme park down in the future.
Adam Beam, Associated Press.
Hi, thanks so much for doing this. So after the tiers were updated today, it appears that schools are now allowed to reopen in at least 32 counties. And if you include the waivers that the state has already approved, there's a lot of schools that are now allowed to be open. Just curious what you all have seen in these counties where schools have been reopened. Have you seen any connection to increased cases, or have the precautions that the schools taken been effective?
Yeah, great question. And I'll just remind you that for a school to begin their planning or plan to reopen with their district, the partners, the health partners, and other community partners, you must be in the red tier for at least 2 weeks before moving forward. So some of those counties that moved from purple into red have 2 weeks now to plan if they choose and believe that they have the conditions that's right to bring in-person education back. To your question, we have not seen a connection between increased transmission and school reopening or in-person learning. We're asking that question constantly. We're looking at the information to see if there is a connection. And so far, we have not found one. I just remind people that it sometimes does take time for us to see the trends, and we want to act responsibly. But so far, it's encouraging to see the tremendous effort and planning that communities and their schools and their staff have done to make sure that it's lower risk for students and staff alike. And we're seeing that fruits early on, and I think that's encouraging for all of California.
Mike Duffy, ABC 10.
Hi, Dr. Ghaly. Now that we have 7 counties that are in the yellow, what comes after yellow, and when can we expect that?
Well, I think many of you heard, probably picked up that the governor said that this is our roadmap for the foreseeable future. We don't have a plan after yellow at the moment. We know that many counties who are in yellow are asking that question, but we wanted a strategy to get through the next many months, to get us through, the winter flu season, especially the worst parts of it, so that we have a strategy to keep California moving forward, staying forward looking rather than moving back. So for the time being, no other tier outside of yellow, but as we did early on, we're planning for the future and working on thinking through those details already.
Victoria Colliver, Politico. Victoria Colliver, Politico. Spencer Custodio, the voice of OC. Spencer Custodio, the voice of OC.
Hello?
Yes, Spencer, is that you?
Yes. Oh, sorry.
Great. No, please go ahead with your question. Thank you.
Thanks for taking our questions. Appreciate it. As more businesses reopen, especially here in Orange County, and there's been a bigger push for Disneyland and theme park reopening, the county itself is not disclosing outbreaks as far as when outbreaks at workplaces, schools, or anything like that. Moving forward, should counties disclose that kind of information to its residents like LA County does? And is there any talk of a potential health order or maybe an executive order on Governor Newsom's part to mandate that California counties do disclose that information as they move through the tiers?
Yeah, I mean, on two lines. First, I think that counties have their own calculation on how and when to share information. I certainly, having been part of leadership at the county level, believe that so many of the residents depend on that degree of transparency and information to plan effectively where they may or may not go. But I think every county, and I respect that county independence, but we work to share best practices across counties. And I don't want to get into specifics about Orange and LA and other counties, but certainly I think as we get deeper and deeper into our response, the transparency of information, not just at the state level, but at the more local level is very important. Some of you will remember very recently that the governor did move forward a bill that asked certain industries to report out on outbreaks defined as 3 or more cases, so that that information is known, and working with the counties to make sure that that's disclosed in the right way, I think is a key feature of making sure we respond effectively, immediately, and in a transparent way to protect our communities as part of what California believes is the way forward.
Victoria Colliver, Politico.
Can you hear me now?
Yes. Good afternoon, Victoria.
Thank you for taking my question. So I didn't get unmuted. I didn't feel like I didn't get enough on the health equity measure. My question has to do with how many counties are in what tier specifically on that equity measure? Is it just positivity rate? Is that adjusted the same way overall positivity rate? And is Humboldt the only county that has been benefited by this new metric?
Great. I'm going to take that as an opportunity to have Dr. Pond come back up and answer that question for you. Just one moment.
Great, thank you for the question. And to provide a little bit more information and detail about how the metric works. So again, we're looking at something called the Healthy Places Index, and that is a proxy for looking at sort of where we see the most communities of color in each county, and looking at, yes, just the test positivity. So you were asking about which metric. We're looking at that test positivity, and what we want to see for each county is now they need to make sure that not only do their test positivity for the whole county, their adjusted case rate, but also their test positivity in the lowest quartile of the Healthy Places Index for that county all need to meet the criteria for the least restrictive tier. So if they're in purple, they need to meet the red for at least 2 weeks before they can move forward to that next tier. So that is sort of the base addition to the new metrics. And then there's also a way that Humboldt County actually was able to do this time, where if a county has their test positivity is actually 2 levels below their current tier. So if they are in purple, but their test positivity is in orange instead of red, and their test positivity of their lowest quartile of the Healthy Places Index is also in orange, 2 tiers below, and their case rate is declining, then they can actually move to the next less restrictive tier. So can't skip to the tier, they still need to go to red from purple, but that is sort of the other way that the new health equity metric that we're implementing this week works. This week, Humboldt was the only county that moved forward because of that. And also very important to know that no counties were not able to move forward because of that metric.
Victoria, I'll just add one other really essential point is that the equity metric is one part of a 3-part plan and approach to focus on equity. The other 2 pieces that I don't want to overlook in any way because they're essential is we've talked about the percentage of cases that are either Latino, Black, or other race or ethnicities. We still lack complete data across the state. We're working with our labs, our healthcare providers, anyone collecting a test, any lab running a test with our counties to increase the availability of that data. A full third of cases were early on without that data. We've improved some of getting all the race and ethnicity data that we hope to have, but it's still not good enough. So working hard on increasing the availability, because without that, we can't really target and know which communities are most deeply impacted. And then second part or the last part of this suite or collection, this framework on equity, is a focus on ensuring that we invest dollars that the state has received from the federal government to work on mitigating and reducing transmission, that counties are using those dollars in targeted ways to focus, as Dr. Pond described earlier, on communities with a disproportionate impact. So it's not just the test positivity, that's the piece that helps counties either move forward or slows them down in moving through the tier system. But we're working with counties on a broader strategy to focus on equity and reducing transmission in some of those impacted communities.
Annabelle Munoz, ABC7.
Hi, you did answer part of my question just now, but I did have a few follow-ups. Still having kind of a hard time following. So the first question is, what is the lowest quartile of the healthy place index. What does that mean? And then in terms of counties moving to another tier, will this help them, but will it also determine if and when they move to another tier? Is this an added component, or is it not determinate?
Yeah, thanks for the clarifying question. So on the first part, what Healthy Places Index does is looks at census tracts within a county. And what we're looking at are the lowest quartile, so the lowest 25% within a county of census tracts on the Healthy Places Index. And what we do is basically take all of the testing volume as well as the number of test positive cases and do a calculation of test positivity just in that 25%, that lowest 25% of census tracts in a given county. And that gives us the test positivity for the lowest quartile of Healthy Places Index tracts in that specific county. And we use that test positivity number and we look countywide and ensure that they are both moving forward into a less restrictive tier. And yes, indeed, if the countywide is moved to the less restrictive tier, but that lowest quartile HPI is not, then the county will be slowed in its movement forward. And as Dr. Pond mentioned, in fact, if that test positivity for the lowest quartile, as well as the total county overall test positivity, is in fact 2 tiers below, then it actually helps a county, just like it did in Humble's case, move forward a tier. So in some ways, there is something that could slow down a county from moving forward. We didn't see that today. We hope never to, because we work hard with the counties to increase their effort around this, but also that this gives an opportunity for some counties to move forward through the tier system because of the focus on equity and ensuring that all communities are moving forward together.
Paul Sidgen, San Diego Union Tribune.
Hi, Dr. Ghaly. Thanks for taking my call. My question has to do with how the administration of steroids to hospitalized COVID patients might affect the current tier system. The president's case has drawn a lot of attention recently to the use of steroids with severely infected COVID patients who are hospitalized. It seems very clear from large studies that the overall rate of mortality is less when you use steroids with this population. Given that we now have this tool to lower the mortality rates, might there at some point be some adjustment to the tier structure to take into account the fact that this disease is overall becoming less deadly?
Yeah, I think that's an excellent question, and I think we highlight, and you remind me to highlight today, that this has not just been about community mitigation, but it's been about an evolving ability to treat individuals who are COVID positive and those who need hospitalizations, and in some cases, intensive care type of services, whether it's ventilators or different medication that helps support their recovery. Steroids is certainly, they aren't a new medicine. We've used them for decades to treat so many different conditions. They have benefits and side effects alike. And I think that their role in treating COVID positive patients is one that's evolving. And like many of the other tools, we expect that they will come together and complement the treatment to make sure that people who have the worst forms of COVID illness are supported as much as possible. So I think more to be seen. We of course hope that they're a tool that helps support all patients who need it, and hope that we continue to learn from its use. In terms of adjusting our tiers, like everything, as we improve our treatments with things like steroids, other medications, the continued planning and support around a vaccine, we will look at all of this in due time as we get through the next many months to determine what, if any, adjustments should be made to our tiering system as it exists today.
Claudia Fischwiller, KNX News Radio.
Hey, I'm sorry if I missed this earlier. I had to step out for just a couple of minutes, but I don't see the health equity measure information on the chart. I see the case rates and the adjusted positivity rates. So where can I find that? And also, second question, do you have any concerns about how the actions of the president and people within his circle might affect, your efforts to convince people of the importance of wearing face coverings, isolating, quarantine, and the like? Thank you.
Yeah, so to the first, if you go to the CDPH website, you will find some information about the equity measure. Not every last piece of granular data at the county level is yet posted. We're working on soon being able to post that, but you can find all of the details, most of which Dr. Pond and I have reviewed here, but that's there and available. In regards to the second question you have, of course, we hope that both federal, state, and local leaders can be aligned in our messaging. In California, we believe it's important to focus on the simple protective actions that people can take, that COVID-19 is a serious illness that has claimed many Californians' lives, let alone across the nation, that we still today have real risk of transmission, that younger, healthier people who might be lower risk for serious complications from COVID still mix with aunts and uncles and parents and grandparents and put those individuals in a precarious position because they, when they are infected, may have pretty serious outcomes. So it's just an opportunity to remind us that all of the tools that we have are important to continue to emphasize. And my personal wish is that all of us can move forward together with that positive messaging and support communities to do the things we know will reduce transmission. So I think we're sort of in a political season right now, and so much is being talked about as it relates to our COVID response. But again, guided by data, guided by science, guided by lessons of the past, we see the path moving forward by emphasizing all of the things that we have done up until now.
Final question, Brody Levesque, Los Angeles Blade.
Good afternoon, Dr. Ghaly. My question is directed at vaccines and the push by the White House to get the vaccine into circulation, even probably before the election. There's a tremendous amount of discussions revolving around whether or not there's going to be enough faith and trust in the American public and people to actually take a vaccine if they perceive it to be rolled out too quickly. With your position and your peers and colleagues in the rest of these states, where are you guys at with the administration's push? Where are we at with the vaccine? And how are you folks interacting with CDC and NIH on this issue?
Yeah, so California has been an early partner with the federal government in talking about how we plan for distribution of the vaccine. We were one of 5 regions or jurisdictions that was invited to have that conversation. We, like others, are looking closely to what the federal government is doing, the FDA, in terms of moving forward with the safety protections that this vaccine, as with every vaccine, must go through. We expect that that is going to be done in a complete and highly sophisticated and high fidelity way. We plan in California to have a team of experts, many who have been part of the national conversation, to review and uphold some of those findings around safety so that we can put the California stamp of approval before we really roll it out across the state. We are deep in the planning process now in anticipation for, potentially a late fall, early winter availability of the vaccine. We want to be ready so that when it is safe, when we've determined that it's available in sufficient quantity for California, that we will put it out there. And we take seriously the need to have a thoughtful and really community-aligned communications campaign so that everybody is following along, and that those who are poised to receive the vaccine after we believe it's safe that we have all of the tools there to provide it. So this is going to be an important area that we will cover here in these Zoom conversations over the next many weeks, and share with you more details on what that planning process looks as it relates to the federal government, but really with the focus on how that's going in California. So with that, I, as always, appreciate the time and attention from many of you, from our reporters who dial in and ask the questions. We're grateful for those. It helps us enrich our information and really deliver what's relevant to so many Californians. And it's hard not to remember, especially now, to do that, to do what Dr. Bond described, to wear your mask, stay physically distanced, get your flu shot, and stay safe. And I really just want to say and end by a continued heartfelt well wishes to those who are evacuated, that are facing the impacts of fires and other disasters across our state. We know that these are hard times, but as we have before, 40 million Californians strong, we will get through this. We will be stronger down the road. And with that, I look forward to seeing you again next week. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.